Hi everybody, my name is Dr. Talia Marcheggiani. I'm a naturopathic doctor practicing in Toronto, Ontario. Today I'm going to talk to you guys about what to do about your Mirena IUD and other hormonal imbalances. Since publishing the original article about the Mirena IUD on my blog, thousands of women have come out of the woodwork running to me to ask for help. When I originally wrote the article, I was spurred on by my observations of the women in my practice who had experienced a rise in something called estrogen dominance and low progesterone after the insertion of their IUDs. And it's ironic because these IUDs were inserted in many cases to treat hormonal imbalances. At that point, I never imagined that so many women would be affected by the IUD, or that even more were suffering from so many hormonal symptoms that drastically affected their lives and their health. I get almost daily emails from women who are telling me about all of their symptoms and how they connected with some of the symptoms that I described in the last two articles about birth control and estrogen dominance. It makes sense because our society does not really set us up for proper hormone function, and I'll explain why. First of all, our diets are very carbohydrate heavy, promoting insulin resistance and blood sugar dysregulation. This can impact our ovaries' ability to make estrogen properly. An excess amount of body fat also produces more estrogen in the body as body fat increases an enzyme called aromatase, which increases estrogen production. This acts as a reservoir, as fat also acts as a reservoir for the toxic estrogens in our environment as they are fat soluble. We lack many of the micronutrients necessary to process our hormones properly, such as vitamin D, the B vitamins, magnesium, zinc, omega-3 fatty acids, glutathione, which is an antioxidant that our body makes but requires different nutrients from our diet to be made, and amino acids. Many of us have impaired or suboptimal liver function or sluggish digestion, which keeps hormones in our bodies around longer than they should be. A dysbiotic gut has the tendency to turn estrogen in the gut back on, putting it back into circulation when it was otherwise on its way out of the body. One of the ways that our body processes estrogen is through the liver and then out the colon. So if we're constipated or we have gut bacteria that are out of balance, that can impair our ability to excrete estrogen from the body. Stress alters our hormone function, including our ability to make progesterone, DHEAS, which is a male sex hormone that's involved in the stress response in women, and also to convert thyroid hormones and to process estrogen properly. Xenoestrogens in our food and environment from plastics, fragrances, pesticides, and processed soy products contribute to overall body burden of the hormones in our body, throwing off our delicate balance and contributing to symptoms. The result of all this is that many women suffer from hormonal imbalances. 10% of women have some form of Pcos or polycystic ovarian syndrome, characterized by the body's inability to properly make progesterone and estrogen instead of making loads of male hormones like testosterone. Pcos alters fertility, promotes weight gain, and causes things like unwanted facial hair growth, acne, and missed periods. And Pcos is often connected to stress and insulin resistance. Many women in my practice suffer from PMS or PMDD, experiencing often debilitating symptoms, sometimes even 2 weeks before their periods begin. They might get migraines, intense cravings for sugar, and massive mood changes such as anxiety, intense irritability, or devastating depression. Panic attacks can occur at this time as well. And many of these women comment that their mood and personalities flip once their hormone levels reach a certain point, causing them to act like different people. This can jeopardize their relationships with their spouses and children, coworkers, friends, and family. Tender and painful breasts or breast lumps are also very common in these women. Acne, weight gain, stress, fatigue, disrupted sleep, depression, and anxiety are all symptoms I see in women with hormone imbalances. And many women have horrific cycles. This is getting good, right, guys? Experiencing painful and heavy periods that often cause them to miss days of work every month. Many of these women struggle to keep their iron levels in the optimal range because of the blood loss they experience each month, and many of them suffer from hair loss, fatigue, and weakness that are a result of hormonal imbalances. I see lots of women in my practice diagnosed with fibroids or endometriosis who are concerned about their risk of female cancers as well as the symptoms that those conditions cause. So they're worried about the risk of breast cancer, ovarian cancer, uterine cancer, and cervical cancer that can be connected to hormone levels in the body. All of these symptoms are often linked to relatively high levels of estrogen compared to progesterone, sometimes termed estrogen dominance by functional medical practitioners who look at the underlying cause of bodily imbalances. I feel terrible that I can't help more of the women who write to me, so my license prevents me from giving one-on-one advice to those who don't live in the province that I operate in Ontario. And I can't really give individualized medical advice to people over the internet, and I wouldn't really want to, because I need to have an in-depth health history and perhaps do testing to fully understand what's going on with someone. I can't just hear a list of symptoms and give recommendations. But it's a shame, because sometimes the solutions are kind of simple, despite how complicated many of the symptoms seem like they are. And so I'm hoping that this video can provide some direction to many of the women that suffer, because I'm going to present some general lifestyle guidelines that you can follow to see if that helps balance your hormone or set you up for better hormone balance. So firstly, I want to state that I'm not against the birth control, and I'm not against the Mirena IUD or other IUDs for that matter. I've been on oral contraceptives before, both for contraceptive use and to treat hormonal imbalances of my own. The vast majority of women with IUD do tolerate it. It's actually a better tolerated form of birth control. And for many women with debilitating heavy periods and things like endometriosis, it might be the only viable solution that actually makes life tolerable. And it is one of the treatments for endometriosis and adenomyosis, which is a similar condition. In my social practice at Evergreen, where I volunteer with street-involved youth, many of the women that I see there who are experiencing homelessness, drug addiction, or dealing with PTSD perhaps from relationship trauma, do better on the IUDs. So some of those individuals do better with an IUD to prevent unwanted pregnancies. Their lives often don't allow for them to remember to consistently take pills every month due to just a variety of factors in their lifestyle and a variety of factors in their health history. The IUD is just far more practical for them. Many women don't tolerate combination birth control because of a history of blood clots, female cancers, or migraine headaches associated with their periods, and therefore taking combination birth control may pose a health risk for these women, and therefore the Mirena IUD, which is only progesterone and theoretically only acts locally, is a safe alternative for preventing unwanted pregnancy. And so that all being said, now that I've given my disclaimer, many women do suffer on the Mirena IUD, and many of them don't have a voice, as they're often told by their doctors that the Mirena or other forms of birth control are not causing or contributing to their symptoms. So they're often invalidated when they go to their doctors and talk about what's going on with them. Whether their symptoms are caused by the IUD or not, it's important to validate those hormonal imbalance symptoms as a sign of something deeper going on with their bodies. Some of these women that I see, or who write to me or that come to see me in my practice, were perhaps put on the Mirena to deal with some of the above symptoms of hormonal imbalance or for contraceptive use. But many of them noticed that their symptoms became worse after insertion of the IUD. So how does the Mirena IUD work, and how does birth control in general work? So the Mirena in particular works by secreting small amounts of progestins, which are a synthetic form of progesterone, into the uterus and surrounding tissues. Progestin is not actual progesterone. It's not fully known exactly how the Mirena works to prevent ovulation, but we do know that it ends up suppressing ovulation, hence preventing pregnancy. This results in either very light periods or a complete cessation of periods until the IUD is removed after 5 years, when the hormones in the IUD run out. So this is wonderful for women with extremely heavy periods that need to miss work or school or suffer extreme pain with their periods. If that's your reality when you have a period every month and then you don't have to deal with that anymore, that's amazing. It might save some women getting hysterectomies or surgeries. But it's important to say here that while birth control can certainly treat the symptoms of hormonal imbalances, it does not correct them. So all forms of birth control, with their synthetic versions of the hormones estrogen and progesterone, simply induce further hormonal imbalances in the body. This is not necessarily bad, but this is the truth. So birth control introduces versions of hormones that may suppress or alter symptoms, such as heavy and painful bleeding or acne, but the versions of these hormones are not fully recognized by the body, so they are not bioidentical. And therefore, they don't fully replace all the hormones' important functions in the body. Estrogen and progesterone have a role in promoting ovulation, maintaining the uterine lining, but they also have a role in mood regulation, immunity, and blood sugar balance. Estrogen has a role to play in increasing dopamine and serotonin levels in the brain, and progesterone breaks down into something called allopregnanolone, which is a GABA agonist, and GABA is this calming neurotransmitter in the brain. So progesterone actually, by way of one of its metabolites, can induce a calming effect on the body. So the effects of replacing the body's natural hormones with synthetic hormones and altering the body's natural hormonal balance while ignoring the underlying cause of hormonal issues is often what causes symptoms to continue or worsen. Keep in mind again that some of these underlying hormonal issues may be genetic or may be a result of things that women can't change, and therefore the oral contraceptive or IUD may be acceptable solutions, especially when the alternatives are far more invasive, like surgery. For example, women with PCOS are prescribed birth control to manage acne or promote monthly periods. So when women with PCOS miss periods, though, it's because they're not ovulating. So the missed periods are not actually the problem. The problem is that they're not ovulating. And that is going to result in infertility when they try and get pregnant, or maybe they're currently trying to get pregnant. Despite that, though, many women with PCOS experiencing amenorrhea or missed cycles will be prescribed birth control. So birth control does not address the underlying cause of the amenorrhea, which is not ovulating. It simply suppresses ovulation. That's the point of birth control, because its main purpose is to prevent unwanted pregnancy. So you're getting periods when you're taking the birth control, but it's not actually addressing the cause of PCOS. The periods that you get while on birth control, I should also mention, are not periods. Periods from birth control are withdrawal bleeds. So after 21 days of taking hormonal pills, the hormones are stopped and replaced by placebo pills. If you have a 28-day pill pack, you'll see there's a line of pills that are a different color. Or you might stop taking pills altogether for those days if you have a 21-day pill pack. The withdrawal of hormones in the pills induce a bleed that resembles a period, but it's not a period. Hormonal contraception does not correct hormonal imbalance. It imposes further hormonal imbalances to manage symptoms. And again, that's not always bad, but it's an important difference to make. Many women do require symptom suppression, particularly if their symptoms are severe. So many individuals in my practice experience periods so heavy that the only way for them to get through the month is with an IUD. And genetic variability in how our bodies process hormones can make us susceptible to intense hormonal symptoms through no fault of our own, and perhaps through nothing that we can change. In my opinion, however, it's important to attempt to address the underlying cause of these hormonal imbalances if we can, and to set our bodies up for better hormonal regulation, making as many changes as our lifestyle will allow. And because you can't be on the pill or IUD forever, and especially if you're planning to get pregnant, you're going to have to come off it. So what you can do about your hormones right now, today, watching this video. So if you are like any of the people that I described above who seek my help, then there are a few things that you could do to get started on correcting hormones. The first thing is to work with a professional. So the first thing I advise is finding a licensed naturopathic doctor, or if those don't exist in your country or region, a functional medicine practitioner who understands hormones, can order lab tests, and will address the underlying causes of your hormonal imbalances by taking the time to fully understand your body and lifestyle. This practitioner might be a naturopathic doctor who you can find in North America by looking one up at naturopathic.org, or a medical doctor, or a chiropractor, or a highly skilled nutritionist or nurse practitioner. Research this person well, read their articles, and perhaps book in with them for a complimentary meet and greet to get a feel for how they operate and how they think. Testing. I often test patients using simple blood tests. I test them on day 21 of their cycles for about 7 to 9 days before they expect their next period. I do this because with a blood test, I can test for lots of different factors, not just hormones, that are going to indicate their overall health status. I'll test their blood looking for anemia, we'll test their iron levels and their B12 levels. I'll look at something called homocysteine sometimes to gauge their ability to methylate, which is an important chemical reaction for processing estrogen. I'll look at their vitamin D levels, or we'll simply treat vitamin D and then assess levels later. I'll look at their cholesterol to see if their diets are promoting proper hormone synthesis. I'll look at their estrogens, their estradiol and estrone, which is a more toxic, problematic estrogen that is sometimes elevated, progesterone, free testosterone, a thyroid panel if they're presenting with symptoms of hypothyroidism, fasting glucose and fasting insulin to calculate insulin resistance using something called the HOMA-IR, HbA1c to look at long-term glucose control, FSH and LH, which are two hormones made in the brain that talk to the ovaries and orchestrate the menstrual cycle, and DHEAS to name a few. So those are some of the things I might order. If we want to do a more in-depth look at hormones, we may do a month-long salivary hormone panel, which you spit into a tube every few days to see how your hormone levels rise and fall throughout the month. Or some women opt for a Dutch test, which is a dried urinary hormone test that looks at hormone breakdown in the urine and in the body to see how your hormones are being processed. So some women will require more testing and others will require less, and cost is always a factor. So sometimes we'll simply go ahead and make some lifestyle changes, see how my patients' bodies respond, and then if we need to do further testing to look at things in more depth, we'll do that. The labs are interpreted from a functional perspective. So even though you've had a blood test with your doctor, and you may be in the normal ranges, which take into account the entire population, many of whom are not healthy because it's derived from data from people that just go in to see their doctor. So people seeing their doctors are not necessarily a sample of the healthy population. These blood markers may not be optimally balanced, giving us the opportunity to correct things before they go further. So testing allows us to match symptoms to underlying imbalances and to be able to properly direct treatment protocols. Women with estrogen dominance may be experiencing high levels of estrogen and normal progesterone, and this indicates a body burden of estrogen or impaired liver and digestive system clearance of estrogen. But other women may be experiencing normal levels of estrogen and low progesterone, indicating a failure of their bodies to ovulate due to high stress and Pcos or the Mirena IUD in a birth control pill, or a HPA axis, so hypothalamic pituitary adrenal dysfunction, which is a result of stress imbalance. And these two women may experience the same symptoms. Other options for hormonal testing, as I already mentioned, are month-long salivary hormone testing or Dutch testing, which looks at hormone breakdown in the urine. And I sometimes run these tests, but I often start with blood testing because I find it useful and accurate and the most cost-effective, and we're able to look at a variety of markers that give us a bigger overall picture of my patient's health. But the most important thing is a complete health history with symptoms to fully understand what my patients are going through, and that is sometimes the only thing that is done. So treatment. Once you understand your individual hormonal situation through testing and working with a practitioner who's putting the testing together with your symptoms and health history, your practitioner may recommend a variety of treatments. I personally combine diet and lifestyle treatments with key herbal and nutritional supplements to target what's going on under the surface. These treatments may include herbs that boost ovulation, or aid liver detoxification, or regulate the stress response, depending on the underlying cause that we're trying to uncover. I might recommend nutraceuticals that encourage methylation or aid in hormone production. So I'm thinking of the biochemical pathways that may be imbalanced, and I'm trying to support those with some of the ingredients needed to run those pathways, to run those hormonal mechanisms. My treatments take into account the individual's symptoms, labs, diet, lifestyle, and any other health issues that she may be facing, like fatigue, digestive disturbances, or poor sleep. If digestion is one of the major things that my patient is dealing with, that might take precedence over hormone balancing because we won't be able to fully balance hormones until digestion is optimized. But what can you do today? Okay, so barring more individualized advice and assessment, these are some best lifestyle practices that will probably do no harm and that can help most women balance their hormones better while they're still using birth control to control and address their hormonal symptoms and prevent pregnancy. So This is obviously not medical advice, so follow at your own discretion. This is just for educational purposes. So diet. So when it comes to diet and hormone support, we need to ensure that we are balancing our blood sugar, boosting liver detoxification pathways, promoting hormone synthesis, and supporting digestion, especially if experiencing constipation. So consume more leafy greens. That's the first thing. Kale, spinach, collards, beet greens, arugula, etc., all of your leafy greens. Eat 1 to 2 cups of these foods every day. Leafy greens contain active folate, which boosts methylation and detoxification. They also contain magnesium, which is essential for hormone regulation, as well as 300 other important biochemical reactions in the body that balance mood and hormones. So consider tossing a cup of spinach into your morning smoothie, or cooking up a cup of spinach with your eggs in the morning, throwing an extra cup on your salad. The next one, consume more cruciferous vegetables. So these include broccoli, cauliflower, Brussels sprouts, cabbage, bok choy, etc. Eat another 1 to 2 cups of these foods every day. Crucifates help the body make glutathione and contain something called indole 3 carbonyl, or I3C, which helps eliminate excess estrogens from the body. Broccoli sprouts are potent players in these pathways, so you can toss those into your smoothie or your salads and try and consume them as often as possible. They're about to come into season soon. The next thing is to ensure adequate dietary fiber intake. So I often recommend ground flax seeds or chia seeds in smoothies, or avocados, and lots of fruits and vegetables and legumes, if you tolerate legumes, in order to make sure that women are having regular bowel movements to clear excess estrogens out of the body. 2 tablespoons of ground flaxseed or more every day can help balance estrogen levels and promote daily bowel movements. So I often recommend this to women who are experiencing hot flashes from menopause, as flax is a phytoestrogen that can help regulate our estrogen levels. It's a very weak phytoestrogen, so it doesn't do a whole lot, but it can often rebalance things for a lot of women. And then the fact that it's a really great fiber for helping promote bowel movements just adds that extra benefit of it. The next thing is to balance your blood sugar. So balance your blood sugar by consuming protein, fat, and fiber at every single meal. A big heaping plate of pasta or a few slices of pizza, not a great meal. You want to make sure that a meal contains a serving of protein like chicken, fish, beef, pork, or a nice big cup of legumes, or a couple of eggs, or a cup of dairy if you tolerate dairy properly. You want to avoid refined starches and flours. Avoid all sugar, even natural sugar like maple syrup, coconut sugar, cane sugar, honey, agave, etc. This may be just temporary as you rebalance hormones. You may want to try stevia or avoid sweets altogether. Limit your carbohydrate intake. So this doesn't mean avoid carbohydrates, it doesn't mean go ketogenic, but you want to keep your grains, legumes, root vegetables like potatoes and sweet potatoes to complement your meals, to be part of your meals, but to not be the sole part of your meal. And you might want to limit those to 1/2 cup to 1 cup per meal, depending on your glucose tolerance and your blood sugar regulation. You want to only consume whole grains like quinoa, buckwheat, steel-cut oats, millet, and teff, and try and cook them yourself. So you want to be buying these things raw and be cooking them yourself, as opposed to relying on things like breads and pastas that are more processed. Avoid soy, particularly processed soy, like vegan burgers or soy milk or textured vegetable protein. So these contain phytoestrogens that are particularly potent and can exacerbate hormone imbalances, especially when they're processed. Consume omega-3 fatty acids. So consume these fats that you can find in fatty fish like salmon and sardines, or nuts and seeds like flax and chia seeds, walnuts and pumpkin seeds. Get 2 to 4 tablespoons of these nuts and seeds every day, and 3 to 4 servings of fatty fish a week. And finally, consume animal products. So eggs, for example, contain choline, which is essential for liver function. Liver also contains choline if you're dairying and you're into liver. Meat contains vitamins B6 and B12, which are essential for hormonal regulation and production. And cholesterol in animal products are the backbone of our sex hormones. Iodine is very prevalent in animal foods and regulates estrogen in the body. If possible, try to obtain organic animal products from pastured or free-range animals to boost omega-3 intake, to lower your impact on the environment, and to promote animal welfare. So, not that a plant-based diet doesn't have a wonderful place in health. I believe in plant-based with the addition of some animal products every single day, either eggs, or I'll do chicken, or I'll do fish, or I'll do some grass-fed beef. Other lifestyle practices are to boost progesterone by managing stress. So establish a self-care routine, whatever this means for you, whether it's bubble baths, manicures, or planning regular vacations if possible. It doesn't have to be somewhere exotic, it can be somewhere small, it can be just a road trip, even small outings. Do some meditation or yoga if that's your thing. Take breaks from work, even if it's just going for a walk. Spending quality time with family. Have a plan to get your work done on time if that's an issue for you. Ask for help if you can. Anything that helps you lower the stress on you. I like the BACE method, B-A-C-E. So body care, doing stuff that helps with self-preservation and nurturing your body, whatever that is. Achievement, so organizing your schedule, making sure that you're achieving the goals that you have set out for you. C is connection and community, and E is enjoyment, so having fun, doing things you like, and setting time aside for that. Sleep. So aim for 8 hours of sleep to get before 12 a.m. Not all 8 hours before 12 a.m. Try and get to bed before 12 a.m. if possible. Practicing good sleep hygiene, by avoiding electronics before bed, keeping the bedroom as dark as possible, and setting a bedtime and wake time. Even on the weekends, if sleep is a problem for you, you may have to be pretty strict about this for a while. Body scan meditations and some key supplements can be helpful for resetting circadian rhythms, and regulating blood sugar can have a major impact on improving sleep. So talk to your functional medicine doctor or naturopathic doctor on individualized sleep solutions. Also, eliminate exposure to toxic estrogens and boost estrogen clearance. So avoid exposure to xenoestrogens whenever possible. So these are something that we're exposed to no matter how hard we try, and so we can't fully be free of them, but we can try and eliminate our exposure as much as possible. So whenever possible, try to use natural body products, deodorants and shampoos, or edible body products for face and hair. Coconut oil is a moisturizer, for example. Avoid plastic water bottles and plastic food containers if you can, especially heating them. Use natural cleaning products around the house. Vinegar, baking soda goes a long way. Avoid fragrances and processed foods, especially processed soy. I try and stay away from things in boxes, things that don't need to be heated, don't need to be cooked, things that contain ingredients that I wouldn't be able to find and source on my own, like maltodextrin. Avoiding maltodextrin maybe is a good idea. Encourage sweating. Get regular exercise or engage in regular sauna therapy. So if you don't have access to a sauna, Epsom salt baths can also work, or exercise like just vigorous, kind of high intensity interval training, anything that helps you sweat. So sweating is a way for our body to release some of these excess estrogens, and some of these toxins that we're exposed to in our environment that can alter our hormone regulation can only be secreted in sweat. Heat therapy has also been shown to benefit the mood and the stress response, so it's just great overall. Feels nice as well. Boosts our brain-derived neurotrophic factor, helps memory and focus and concentration. Heal your digestion. So make this a priority with your naturopathic doctor so that you can absorb the nutrients from the foods you're eating, as well as encourage daily bowel movements and optimal microbiome balance, as these help with hormone balancing and regulation. And the last thing is maintain a healthy weight. So this is a little bit of a touchy subject, but body fat is metabolically active, and it can increase overall estrogenic load. Work with your naturopathic doctor to maintain your weight. So one thing is we often attempt to lose weight in order to become healthy, and I don't want this article to be another one of those things that encourages that standpoint. I find that my patients have far more success, and it's a lot more fun and encouraging to attempt to get healthy and then lose weight as a side effect of that. So by balancing hormone levels, we may notice weight loss, and then the weight loss may further help with balancing hormone levels. Healthy weight loss, often, it's not so much about restriction or dieting or counting calories. Those may have to be something that we do depending on what we're dealing with. But a lot of the time, healthy weight loss just involves managing stress, sleeping 8 hours a night, avoiding processed sugar and processed foods, and instead eating whole foods, not feeling hungry, and regulating our blood sugar, as well as encouraging proper sweating and liver detoxification. So a lot of the time it's just about really healing our bodies, feeling healthy, and then weight loss and hormone regulation are happy side effects. For more, go to my website, taliand.com, and if you like this video, follow and continue to watch.